Hi, so I'm joined today by Kristin Schneeman, who is Senior Director of FasterCures, which is part of the Milken Institute. And we're going to be talking about health equity. But before we start, Kristin, are you able to share with our viewers just a little bit about your background and how you came to be part of FasterCures?
Yeah, absolutely. Well, and thank you so much for having me, Fiona. I really appreciate it, and I'll particularly appreciate being able to talk about this very important topic at this event. So, as you noted, I am a part of the Faster Cures team at the Milken Institute, and I'll just mention for those who don't know the Milken Institute that we are a think tank, and we hope a catalyst for action as well. And the Faster Cures team, as our name implies, is sort of interested in how the biomedical innovation ecosystem is performing, and we try to look at it from a systemic perspective and try to understand where the barriers and challenges are that are slowing progress for everybody. So regardless of condition or sector, and we try to bring people together to try to address some of those challenges. And we came to this topic of health equity, I would say, most recently through our work to understand lessons that we were learning from the pandemic, from COVID-19. In 2020, we spent a lot of time, as many people did, trying to capture lessons that we were learning in real time. And we've spent the last few years trying to actively work to ensure that we don't unlearn a number of those lessons now that the urgency is subsiding for people. But for us, the pandemic really exposed a lot of fault lines that we have always believed slow progress in biomedical R&D, even in the best of times. We also saw remarkable innovation in the R&D process that was born out of necessity during the pandemic. One of those fault lines that we clearly saw was those longstanding racial and ethnic disparities in healthcare and research. I mean, the pandemic really elevated those to public consciousness to an extent I certainly had never seen before. And sparked quite a lot of commitment and investment to try to alleviate those disparities by government, by industry, by underserved communities themselves. But these are really deep, long-term, complex problems. They're the legacy of decades of exclusion and mistrust. There aren't any easy, quick fixes. So sustained commitment and investment is really going to be critical. And so we're happy to put our shoulder to the wheel with a lot of other organizations to try to keep that momentum going. So.
Great, fantastic. And there's a lot to think about there. But before we jump right in, and we're going to really explore some of those things that you mentioned in more detail in a few minutes. But we are here to discuss health equity. And my first question to you, because maybe not all of our audience is really familiar with what health equity means and why it matters. So it's probably maybe my first but most important question. So to you, Kristin, what is health equity? And for those in the audience that might not be close to the topic, why does it matter?
Yeah. Well, why does it matter? It matters for a number of reasons, and the first and most important of those is that it's the right thing to do to try to address these disparities. As I mentioned already, these are issues that have been decades, if not centuries, in the making. But again, during the pandemic, I think what people really saw very clearly was that minority communities in the U.S., I'm speaking from the U.S. perspective here, but I think it was also true in many other places, minority communities really were disproportionately impacted, far higher likelihood of hospitalization and death. And that was the result not only of the specifics of this virus, but of longstanding disparities in health outcomes, in access to health care, in trust and participation in research. And I'll say from the research perspective, sadly, that mistrust in research has been earned over a very long period of time. People in minority communities are, we know, more likely to suffer from chronic conditions like diabetes, like heart disease and asthma. They would benefit disproportionately from advances in treatment for these conditions, but they're woefully underrepresented in clinical research. In the US, almost 40% of the population belongs to a racial or ethnic minority, but clinical trial participation, even today, remains overwhelmingly white, in some cases 80 to 90% of the population in a trial. So those are numbers that just have to change. I would say the second reason it matters is that it matters to getting the science right. Regardless of the moral imperative, we won't get the science right unless we are studying new treatments, new approaches to health interventions in the populations where those conditions are prevalent. There may be differences in those in how those conditions show up in different communities and different people, and we won't get to the right answers if we're not studying these things in diverse populations. So there's a self-interest in the research enterprise in getting this right. And finally, there are economic imperatives here. It's good for business. It's good for the national economic health. I think companies all want to develop products that work for their intended end users. And there's plenty of evidence to show that effective community engagement results in products that are more likely to serve people's needs and that are trusted and adopted by patients who need them. And there's also plenty of research to show. There was recently a National Academies, a fairly extensive report that had some terrific economic analysis showing that lack of representation in clinical trials can cost hundreds of billions of dollars in lower life expectancy, higher disability, and other costs to society. So there are a lot of very good reasons why we need to address these challenges.
Thank you so much. So you spoke a little bit about the COVID-19 pandemic, and completely agree. It really shone a significant light on the importance of equity in clinical research globally. And we saw, efforts really ramp up with some very significant investment around the pandemic. But having now kind of exited the pandemic, albeit to a new normal, do you think that the different stakeholders are going to maintain that level of focus?
Excellent question. We certainly hope so. I will say early indicators are not great. We haven't bent any curves yet. Representation in trials by recent measures continues to decline, and racial disparities in life expectancy are continuing to widen, unfortunately. But we did actually at FasterCures go through an exercise recently. We revisited a set of recommendations and the lessons learned that we collected during the pandemic at the end of 2020. We revisited those recommendations at the end of last year and put out a bit of a scorecard to say, how are we doing at not unlearning those lessons, including around addressing these disparities? And I think we were pleasantly surprised to find that attention has been sustained in the near term. So over these 3 years or so, actions are being taken. Some limited progress is in evidence. I'd say, government has exhibited some leadership in putting out objectives and goals, and industry is initiating and funding individual and collective efforts to set goals and demonstrate best practices with some great results in some cases. A lot of organizations like ours, national academies and others have provided recommendations and extensive resources to help stakeholders understand how to do this work better to recruit diverse participants to trials. We actually think there might be too many sets of recommendations in some respects. So we're actually engaged in an effort right now with national academies and some other organizations to try to bring some of those sets of recommendations together and rationalize them and prioritize them. But I think sustainability and accountability are going to be important watchwords going forward because, as we've already discussed, these are long-term, deep, complex issues. And so we need to sustain that investment and that attention.
Absolutely. And, I think it's really interesting because, that topic of diversity in clinical trials, it's been like the hot topic over the last number of years. And we have seen so many stakeholders come in and have a view on it. And perhaps most prominently, the FDA have introduced diversity action plans. But what do you think is needed, to your point on accountability, to hold organizations and industry accountable to actually implementing those?
Yeah, that's critical. And I think there's a level at which government and philanthropy are very good at inspiring commitments like this. They're very good at collecting data. They're very good at issuing report cards on whether and how we're improving. We've already put out one report card. Those are roles that government and philanthropy is very well situated to play. You called out FDA. They're obviously a key player in incentivizing industry's actions, in particular. When FDA says something's important, industry tends to sit up and take notice. They have now required diversity action plans of sponsors when they're bringing product programs forward. I will note there's a draft guidance out for comment related to data collection around those diversity action plans, and so encourage any listeners to who have an interest in this to be sure to provide comments to FDA back on that. Those are important actions, but I think there are often questions then about how FDA is going to utilize information from efforts like that. I think this came up in the context of patient engagement, which is another topic that FDA has been very proactive on and stimulated industry's interest in engaging patients more fully in the R&D process and getting their perspectives. But then there are always the questions about how does FDA actually use that information in their evaluation and decision making. So I think it's going to be really important for FDA to bring some clarity to that, to continue industry's interest in and commitment to things like this. I'll note that FDA also has played an important role already around questions around study design and eligibility criteria. So diversity action plans are one thing, but even before the pandemic in 2019, I think, as a result of the last round of user fee agreements, FDA had put out guidance around how sponsors might use eligibility criteria, enrollment practices, trial design elements to help enhance diversity in trials. And I feel like that's gotten less attention than these diversity action plans. Feels like an easier thing to wrap your hands around, but there are other mechanisms that are important, and FDA has indicated flexibility around what sponsors bring forward to help enhance diversity in the area of trial design. So I wanted to call that out as well. I already mentioned that industry has already been working to hold itself accountable by setting internal goals and being transparent about how they're doing in tracking against those goals for more diverse participation. That's fantastic. They are bringing new positions forward in companies, leaders whose portfolio is explicitly around diversity and inclusion. But those leaders need to have resources and authorities within R&D decision making, not just marketing and access, which is where those roles often fall most naturally. So I think there's great activity going on both in industry and government, but more needed and more sustained accountability is going to be necessary.
I was particularly interested when I read your paper on human capital and that perspective in terms of the role of building infrastructure and the role that that can play in achieving diversity in clinical trials. Can you comment a little bit more on that and the impact of challenges around human capital?
Yeah, absolutely. So we have felt that there's a lot of attention being paid to engaging diverse participants and individuals in trials and what's needed to make that happen. We've been part of that. I've already talked about a lot of other efforts around these issues of how to reach individuals and connect with individuals and build trust and engagement, and that's really important. But we've kind of observed that it seems that there's less attention being paid to issues around the infrastructure that's needed to bring clinical research opportunities closer to communities. So it's not just about connecting to those individuals, but all the other stuff that needs to happen to be able to run trials. So bringing trials to patients means recruiting sites where they get their care, as well as using tools like remote or mobile visits when that's appropriate and feasible. It also means recruiting providers from minority communities to participate in trials and giving them the resources and support they need to serve in that role. So community hospitals, health centers, provider practices, they need to have access to the personnel, the resources, the technology that they need to engage in research. Technology platforms and data collection have to be better standardized and harmonized, and they have to be minimally burdensome to sites and staff. these institutions that don't have a long history of engaging in research, like the big academic medical centers, they can't sustain using 15 different technology platforms, that different sponsors bring with them. We need to alleviate that burden on those new types of sites and individuals. And finally, community sites and their partners have to have access to a sustainable pipeline of research opportunities, particularly industry-sponsored trials. It can be a fairly transactional affair. And these less experienced sites need to have some confidence that they're going to have sustained opportunities to engage in research studies in order to be able to prioritize that. They can't do sort of one and done. That just doesn't work for some of these less experienced sites. So there's a lot happening at that level that we think of as infrastructure that we think needs more attention paid to it. And that's certainly an area that we're focusing on at FasterCures.
Yeah, that's a really important point around the pipeline of studies and being able to then develop and grow not just the capabilities, but the relationships with the local population that are, perhaps specifically underserved and therefore, the target for that particular type of work. So what I'm hearing from you, this has been a really fascinating discussion, Kristin, that there has been some progress and we have seen some leadership from government on these issues, but as far as health equity is concerned, this is an ongoing process and there's still very much a lot of work to be done. Thank you very much for your time today, Kristin, and I hope you have a great rest of the day.
Yeah, my pleasure. Thanks so much for having me.